The best early preventive tool for breast cancer is breast self-examination. That's the examination that is done by the woman herself. We advise every woman to examine her own breast every month. So if it's a pre-menopausal woman, she has to do this examination after her menses. So let's say 1 week after her menstrual flow. If the woman is post-menopausal, then she has to pick a day in the month to examine her own breast. In a country like ours, and in most African countries, we don't have screening mammography. So all we can do is to examine our breast ourselves. I must here say that most cases that are seen in the hospitals are those that are found by the women themselves. So breast self-examination in our part of the world is very important. And how can we properly examine our breasts? So I mentioned earlier, you finish with your menses and you examine your breast, or you pick a day in the month and you examine your breast. When you are going to examine your breast, you have to find a place where you have some privacy, and you show your breast, remove them, expose the breast, and then you look at your breast in the mirror. If you don't have a big mirror in your room, just put a small mirror on the table and stand in front of the mirror and examine the breast whilst you are in an upright position. So examine the skin covering the breast. You are checking whether the skin is smooth, whether there's some dimple anywhere in the skin covering the breast, whether you have some pudorage or skin of the lemon, like the lemon peel on some part of the breast. And also you look at the nipple. Do you have any rashes on the nipple, any peel, any ulcer? If you don't have any of these, you still have to look for an abnormal discharge. So you squeeze the nipple with your thumb and your index finger, just a little squeeze. If there's any abnormal discharge, it will come out on its own. After doing this examination, this visual examination, you are now going to examine your breast in the lying position. So you find a place, a level ground, and you lie down. When you are going to examine your left breast, you have to put your left hand behind your head, and you use your right hand, the palmar aspects of your fingers. That's the most sensitive part of your hands. So your left hand is behind your head, and your right hand will go to examine your breast. So let's assume this is your breast. You are lying down. You send your hand to the breast, do the palpation, superficial and deep, superficial and deep, checking whether you find a lump somewhere, whether you find some thickening somewhere, whether some place will be unpleasant, whether it's some dull feeling somewhere. Check whether there's any abnormal feeling anywhere in the breast. Don't forget to check the area around your nipple, what we call the areola. So you check whether there's any lump or any thickening anywhere. After doing this, you have to go to your armpits, the axilla. A lot of women have what we call axillary breasts. If you have them, it means you have some breast tissue in your armpits. So go and check them, whether you find a lump there or some thickening or anything abnormal there. If you don't have axillary breast, everybody, both men and women, have what we call lymph nodes in the axilla. When there's a problem in the breast, the lymph nodes in the axilla are normally the first point of call. So even though you might not palpate anything in the breast, you could palpate something in your axilla. So if you find something in your axilla and you are not finding anything in the breast, you should still report it to the hospital. Any abnormality you find should be reported to a doctor. You don't have to expect pain during the early stages of breast cancer. So if you find something and it's not painful, do not say there's no pain, so there's no danger. Breast cancer is not painful from the beginning. After examining your left breast, please turn and go to your right breast. The same way you put your right hand behind your head and you use your left hand, the palmar aspect of your left fingers, the 3 middle fingers. Those are the places that you use to check for any abnormality in the breast. So like you did for your right breast, you press and making sure that you are doing this kind of palpation throughout the breast. You could also do some vertical exploration, so that you start from the top and you go towards the inferior aspect. This examination, after here, you go to the armpit as well. The same way you examined your armpit, your left side. On your right side, you have to examine the armpits. This examination, this simple examination, can be the examination that can save your life. It's simple. You don't need to pay anything to have it done. You don't need to go anywhere to have this examination done. It's one sure way that we can find lesions in the breast early enough so that you'll be cured of whatever it is that you are having in the breast, whether it's breast cancer or not. Thank you.